Today, we're going to talk about a topic that's incredibly sensitive, but also really important: miscarriage. We're going to break down the science behind why pregnancy loss happens in a way that's clear and structured. Understanding the why can be such a crucial step. So let's dive in.
This is the question, isn't it? It's the one that feels so huge and overwhelming. But in medicine, the answer often starts not with what, but actually with when.
And this right here? This is the key. The timing of a pregnancy loss gives us the single biggest clue to what's really going on underneath. We're going to look at this through two totally different timelines.
Okay, our first timeline. We're talking about early pregnancy loss, anything before 12 weeks. And this is where about 80% of all miscarriages happen. The main reason for these losses, most of the time, has nothing to do with the mother's health. Instead, it's usually an issue with what we can call the genetic blueprint of the fetus itself.
That's a huge number, right? Somewhere between 50 and 60% of all of these early losses are caused by a completely spontaneous, random error in the fetus's chromosomes. It's not something anyone could have prevented, it's a problem that was there from the very beginning, at conception. So what exactly is a chromosomal abnormality? Well, the best way to think about it is like a major typo in the instruction manual for building a healthy baby. If those core instructions, that genetic blueprint, are fundamentally flawed, the embryo just can't develop correctly, and the pregnancy very naturally comes to an end.
And these blueprint errors, they come in a few different flavors. The most common are what we call trisomies, which is just a fancy way of saying there's an extra copy of a chromosome. Others could be monosomy X, where one is missing, or even triploidy, where there's a whole extra set of chromosomes. The critical thing to remember is that these are almost always just random, one-off events that happen during cell division.
And if we want to get really specific, the single most common chromosomal error that we find in early miscarriages is trisomy 16. It's a genetic condition that is just not compatible with life, and it almost always leads to a miscarriage in that first trimester. So there's a really concrete example of a blueprint failure.
Okay, so let's move on to our second timeline. If a pregnancy makes it past that 12-week mark, the chances of a major genetic issue drop way down. So now our focus shifts. It moves away from the fetus's blueprint and onto what we'll call the maternal support system, basically the environment where the baby is trying to grow.
So what can go wrong with this support system? Well, the issues tend to fall into a few main buckets. We're talking about structural problems with the uterus itself, a weakness in the cervix, or maybe some underlying systemic diseases in the mother that can affect the pregnancy. Think of the uterus as the baby's first home. If the structure of that home isn't quite right, let's say there's a wall down the middle, called a septate uterus, or big fibroids are taking up space and hogging the blood supply, it can make it really tough for the pregnancy to keep growing safely. Now, this one is a really important cause of later loss. Cervical incompetence is a condition where the cervix, which is supposed to act like a strong gate holding everything in, starts to open up way too early, and crucially, without any pain or contractions. It just can't handle the increasing weight of the pregnancy.
And this shows you exactly how it works. It all starts with a weakness at the internal opening of the cervix. Then, as the baby gets bigger, that weak spot just gives way, and the cervix opens up painlessly. This often leads to a sudden loss of the pregnancy, which feels very different from an early miscarriage that might involve cramping.
So, this table really pulls it all together. And honestly, if you take one thing away from this explainer, this should be it. Early loss, before 12 weeks, is most often a blueprint issue, a problem with the fetus's genetics. Late loss, between 12 and 20 weeks, is way more likely to be a support system issue, a problem with the maternal anatomy or health. Of course, it's not always quite that black and white. There are other factors that can play a role in pregnancy loss at any stage, so it's important we touch on those to get the whole picture.
Paternal factors, for example, are often overlooked, but they can definitely be a piece of the puzzle, especially with recurrent loss. Things like advanced paternal age or sperm DNA issues can contribute to those blueprint errors we talked about. And then on the environmental side, things like smoking, heavy alcohol use, or radiation can create a hostile environment by damaging DNA or cutting down blood flow to the placenta.
So why did we spend all this time separating early loss from late loss? Why is this whole blueprint versus support system idea so important to understand?
Because it's a core clinical concept. This is basically the rule of thumb that doctors use to start their thinking. It immediately helps them focus their investigation on the most likely culprits based on timing alone. It's a really high-yield piece of information.
And this is why it matters so much to people. For anyone who's been through this, knowing that an early loss was probably due to a random genetic event and not something they did wrong can be a huge relief from guilt. For doctors, it tells them what tests to run, and for the future, it helps everyone manage expectations and focus on what can and can't be controlled.
Understanding the cause is powerful, but it really is just the first step. It opens up that next set of questions about prevention, treatment, and care for what comes next. And that, of course, is a whole other part of the journey.